foaming in. And knocking. Hello there. My name is Sarah and I'm going to be your nurse today. How are you doing? Good? All right, I'm going to provide us with some privacy here. There we go. And before we get started, is your name Mr. James Johnson? And is your birthday 12/15/84? It is. Okay, and that's what your wristband says, and I'm looking in your chart and that's what it says as well, and I'm just verbalizing that for him since right now he has a trach place, so he is unable to verbalize that himself. Alright, well, I'm just going to raise up your bed here, and I'm just assessing your trach as I'm raising your bed. Are you having any difficulty breathing? You are, okay. Well, from what I can see, and I can listen also with my stethoscope to assess better, but it's looking like you could use some suctioning. So I'm going to quick verify in your chart here that you can have that. And I see that you have an order for suctioning as needed. And I think that would help you right now. So I think that's what we'll do. Do you have any pain right now? No? Okay, perfect. If you do in the future, or if you did, so right now we could get you some pain medications that would make suctioning less uncomfortable for you, but since you don't, I think we'll be good and just get started. All right, sounds good. So, just coming over here, and before I begin doing anything else, I'm just gonna look and notice that I have my emergency supplies here. This includes a mask, which I will be using today, and some extra ties, the backup trach kit, which includes an obturator, and then a trach one size smaller than the one he has right now, and one that is the same size. Small ones in case of emergency when it falls out, and if we couldn't fit the same size back in. We have a syringe here. This one's a 12 milliliter, could be 6 to 12. And then we have the scissors, mask, and then we have this oxygen bag here, which we're going to be using in a bit. I'm just going to turn the oxygen on right now. It's a 15 liters, and I'm going to turn it a little lower just so it's not so loud for the video, but it's at 15. And then also our suctioning, which we'll be using as well in a bit. So I'm just going to turn that on now. And it's set to 100, which is right about where we want it to be. Alrighty, I'm going to keep this here and then get started. I'm going to begin by setting up my sterile field. Almost setting up my sterile field. I have a few things to place before I do that. This being one of them. This is just to keep your gown clean in case any little surprises come out while we're suctioning and trying some trach care. This is for a little bit later, and this is a biohazard bag that we'll be using since we're doing the secretions. And then this right here. This is the point at which I will put my mask on for the sake of being able to be heard in the video. I won't be using it today, but it's on. And then move that out of the way. I have some extra supplies here that I'm going to be using in a moment, but I'm just going to set them to the side so they don't get in my way. I have my normal saline and my suctioning catheter kit. I'm going to begin by palming and lipping to get rid of any bacteria that might be on the cap. I'm going to set that to the side. And then pull those off. Palm. Now I'll be setting up my sterile field. So I'm going to be opening this up right now. It's already open since there weren't any brand new ones. But opening it up, and my gloves are on top, which is great. Alright, so I can grab my gloves and open them up. this. Alright, both my hands are sterile, so I can pick up anything I want in the sterile kit. This is for our water, and this is my tubing. So keeping this sterile. I'm going to tightly wrap it. I'm gonna do it the other way. Alright, perfect. Alright, so right now this is sterile. And I am now going to let this hand become clean and not sterile. I'm going to pour, it's on my lips, so I can go ahead and pour about halfway. This is my clean hand. I'm going to go ahead and grab my suctioning and attach it. And I can hear it's working, which is good. So this is still sterile. Alright, so I'm about to start suctioning, so I'm just going to start by checking and seeing if it's working by suctioning up some water. This is also going to act as a lubricant, so it's working. Alright, so at this point I'm going to hyperoxygenate my patient, and my fellow nurse is going to help me with this. So keeping this sterile, I'm going to grab the bag and place it on. There we go. And hyperoxygenate. This is because during suctioning you won't be able to breathe very much at all. So I'm going to do that. I'm going to stabilize it as I pull it off. Perfect. Thank you. Alright, and now we're going to begin making sure we only do it for no longer than 15 seconds. Keeping things tight, I'm going to insert it 11 centimeters. And do as gently as possible, and then pull it out once it reaches 11. Alright, perfect, thank you. You can give them some oxygen while we're waiting, and I'm just going to quick examine my secretions. Notice the amount, the type, the consistency of it. There's copious amounts, a little bit if it's stringy or anything like that, and then I'm going to clean it out. And are you doing all right there, Mr. Johnson? Okay. I'm thinking another suctioning would be good. Do you think so too? Yes. Okay. So we're going to do some more suctioning. Can you take some deep breaths and try to cough while we're waiting? Okay, thank you. So I'm going to wait 30 to 60 seconds before I suction again. And then I'm going to hyperoxygenate before I suction again. So I'm going to have my fellow nurse hold it. Thank you. Grab it a little closer up. Alright, a few more breaths. Alright, that makes a weird noise there. Alrighty, then hold on to it. Hold on. Perfect. Alright, and we're going to do one more round. So once again, start at 11 inches or centimeters. And once it's in, and suctioning. Alright, perfect. Are you feeling alright? So I'm taking a look at it and assessing it, and from my assessment, I think that we've done enough suctioning. I wouldn't want to do more than 3 times. And are you feeling like you can breathe well now? Alright, so I think we're going to be done. So I'm going to take this off. This over here. Suction off at this point. Dispose of this. And then at this point, if you would help by stabilizing the tube, I'm going to pull off the dressing because we're going to be changing that now. Just getting rid of that. Perfect. Alrighty. So you just want to sit tight. We're just going to clean up your trach side a little bit, okay? Alright, so at this point, I'm going to be putting some more gloves on and setting up for my next skill. So this here is a sterile bowl, but as long as I don't touch the inside of it, I can reach in and grab it with my non-sterile hands, and the inside will remain sterile. And I also have some gauze I'm going to get ready. This as well. There we go. Okay. Right. So I have turned my back to my sterile field, and even if I had, I have my other nurse here watching it. So you know it's sterile, and I'm gonna get my gloves ready here. To open them up and then place my Q-tip or my cotton tips inside the stick. So now I can grab these because my hands are sterile. Alright, I'm going to set them here. Alrighty, so it has some oxygen right there, so we're going to pull it back a little bit, and I'm going to use my non-dominant hand to pull out the octrate or the inner cannula. I can do that now. And I'm just going to place it right here. This one is just clean now, it's not sterile. But that means that I can take off this cap and pour my normal saline, and it's already been left. And do that. Alrighty, and now I get to clean it. So I'm going to use this hand. And I can use a lot more Q-tips, but since it's not very dirty right now, I'm just going to use these two. And you're going to use one per swipe and clean from inward towards the outward. There. And one more time this time, we'll get it underneath. And if you want to help just by stabilizing a little bit so I don't move anything around too much, thank you.
That was a very solid run. Okay. Like, it wasn't, but every...
Perfect. Alright, so this hand is still sterile. This one is not. This is my clean one. So I'm going to use this one to get my gauze, dab it dry, and we're going to dispose of it. And then one more time. Should I get everything? And then now I can go ahead and I'm going to place my new tip here. I think before that, while I still have a sterile hand, it might be a little easier to place this in. Now it's not sterile, but that's okay because as long as I touch the outside of this and not the inside, it's all going to be fine. So I'm going to slide it under now. She's helping ensure that nothing becomes dislodged. Thank you. Alright, and then lastly, we're going to be changing these ties. So, both my hands are not sterile anymore. So while she holds it, I'm going to go ahead and remove this. Thank you. And then go underneath. And around. And tie up. There we go. Perfect. And now I'm going to ensure that it's tight enough, so I'm going to check, and I can put one finger under, but not two, so that's perfect. And then we'll go place the oxygen back there. Alright, is that feeling a little better? Good. Alright, well I'm just going to finish cleaning up, and then I'll be out of here. So I would clean up, move the bed down, foam out, and leave, and then I would also chart what I had done. And that would be it.